Okay, ready, set, go! Is that fun? Oh, what fun. Now what? Back to the swing. Gianna was born 24 weeks and 14 ounces was her weight. So I was 4 months early. And basically what happened, you know, we tried for a long time, so when we found out that we were pregnant, we were very happy. And early on, I thought something might have been wrong because I didn't quite feel pregnant. I didn't get as big as I should have been for that period. I kept asking the doctor. He kept telling me there was nothing wrong, and there was no signs of anything. I didn't have swelling. I didn't have, you know, all the signs that you have with, you know, what I wound up having, which was preeclampsia. So at my 6-month appointment, I went into the doctors and they told me that my blood pressure was 185/90. And suddenly, because I was there, you know, you go every month. So I went at 5 months, everything was fine. A little bit of swelling in the ankles, not a big deal. I said, listen, I don't feel the baby kicking. He's like, that's okay, it's your first time you've been pregnant, okay. So I was a little worried. I just thought something was off. So when they told me my blood pressure was that high, and they said, let's check it again in a few minutes, you just got here, maybe you're nervous. So they took it again and it was higher. So they said, you need to go to the hospital, everything hopefully will be fine. Hopefully it's just going to be a passing moment and you'll be fine. So I go to the hospital, the local hospital, and they hooked me up to blood pressure equipment, and it just kept going higher and higher. And the nurses are looking at me like, why are you still sitting here breathing? I mean, it was 190 over, like 193 over 102, right. 105, really high. So at that point, they started telling me they were going to give me magnesium because that helps, prevents a seizure, I believe. So I was nervous because I didn't feel confident with this local hospital. I don't care for this hospital and didn't know if it was the right thing. There wasn't an OBGYN there. These people weren't doctors. And they're telling me they're going to give me this drug and it's okay. You're going to feel sleepy. Don't worry about it. Okay, so then a while later, the OBGYN that was on call, because it was late at night by then, she came into the hospital. And I had never met her because it's a group of doctors at my OBGYN, so I had never met her before. And she said to me, do you know what preeclampsia is? I said, yeah, I've read about it in my book. She said, well, that's what we believe you have. And since it's going up and up, we need to give you medication. We're going to give you the magnesium drip. And we need to get you to a hospital where you can deliver a preemie this small and this early that they can handle. And my reaction to that was, I'm 6 months pregnant. Like, you can't possibly deliver a baby at 6 months. She says, well, believe it or not, you know, they can do amazing things nowadays with preemies. And, you know, you're 6 months, but if you're above a pound, they really can do amazing things now. But we need to get you to a hospital that has a level 3 NICU. And we don't have that here. So you have a choice of Lehigh Valley Hospital or Abington. And I don't know anything about Lehigh Valley, and I know Abington's a wonderful hospital, so I said, please try to get me to Abington. And we had to wait a couple of hours before they admitted us because the NICU was so full. So finally she came in and she said, okay, I heard back from the doctors. They have a bed open. They have room for you, and we can take you there. So they, you know, and I was beside myself in terror. I mean, I thought, a pound? Are you kidding me? 6 months? How can a baby survive at 6 months? And the only thing that I really knew about premature babies was I worked with someone who had a 3-pound baby, and I remember that she was there for months and months and how difficult that was. So I thought, a pound? You know, I mean, I can't even imagine. So they sent me to Abington by ambulance.
All of a sudden you're thrust into this traumatic situation within hours. And now you're going to have to give birth to a premature child. And it isn't like you know anything about that. You know, while you're pregnant, you're not going to read about all the complications that may occur if you have a premature baby, in this case an extremely premature baby. You're just not prepared for that. So you're going from a normal situation into a very hard situation, an emergency, really. And Tina herself was, you know, her blood pressure being so high, they're trying to stabilize her, keep the baby from being born for as long as possible, but not at the risk of having Tina suffer complications. Like I said, this is all within a matter of hours.
Sing it louder. Can you do it louder? Is there a party in your tummy?
Yeah. Yeah.
It was really scary because I was on the verge of having seizures. I mean, your blood pressure's that high. They couldn't get it down. They stabilized it, but they couldn't get it down. Then they do an ultrasound. They come back. We think the baby's a pound. And they give me the ultrasound picture, you know, the strip, and it's hanging on this machine that's hooked to my stomach that's got the baby's heartbeat on a speaker system. I was concerned about the baby because I thought a pound. You know, they started to give me steroids for the lungs in preparation to deliver this baby. So, you know, and at that point, I guess the doctors didn't really know how long I was gonna be able to stay pregnant, and they sent the neonatologist in, Dr. Moonjin. He came in and gave us the speech that I guess they give all parents who aren't prepared for this. Like he said, we got thrust into this situation, had no clue what was going on. And he gave us a speech, told us that if the baby's around a pound, which they're hoping it is, we have a very high chance of not surviving past a day. If she does survive, the chances of her having very long-term, you know, brain bleeding, cerebral palsy are very high. I don't know the statistics, but they were above 50%. I mean, it was like 80% chance that the child wouldn't make it.
Yeah, it's a very real discussion.
It's like,
if you have this child, here's the percentage or probability that this, that, and the other may occur. It's a preparation. It's very, you know, it's a very strong preparation, but it's realistic as to what may occur, you know, this early in giving birth.
So this is your decision, and if you're not prepared to handle this, then you need to make that decision. It's up to you. And I said to him, no way, we have to do this regardless of what the outcome is, because we might not have another chance. What's a tap shoe? Oh, okay.
Castle.
Is that a castle? So, it is? You know, down to the operating room, and when they weighed Gianna when she came out, they came over to me, Dr. Cleary came over to me and he said, your baby is 14 ounces, not a pound and 3 ounces that we thought. So the risks are even higher. They're extremely higher now that she's less than a pound. The percentages of survival go way down at this weight. So
they immediately had to get her on a ventilator, and at the point of birth, the issue was, did they have a tube small enough to get into her lungs?
And Dr. Cleary said to us, what do you want to do?
Right,
and
so at that point you make a decision, because she was on the edge of viability. So we decided that we wanted to have her ventilated, and he was going to give it his best shot. He found the smallest possible tube you can possibly have in a hospital to stick into a baby's mouth and into their lungs. And even then, it was just it was a crapshoot as to whether it would work or not. So he went over and did it, and came back and told us that, you know, it was successful, and she was hooked up to the oxygen. And at that point, really, that would be kind of the point where you really begin your NICU journey.
Yeah, and he said it wasn't easy. He said, but you know what? She's kicking, that little feisty daughter of yours, remember? He said her little teeny tiny arms and legs are kicking like crazy.